Welcome to this explainer. You know, the human hand is an absolute marvel of biological engineering. I mean, think about it. It's capable of both immense brute power and microscopic precision. But none of that incredible function happens without the crucial neurological wiring that powers the whole shebang. So today, we're going to trace the path of a vital biological highway, look at what actually happens when it encounters a massive physiological traffic jam, and unpack the science behind a condition that affects millions of people. Let's dive right in by starting with a simple, everyday question. Why do your fingers tingle at night? It's that highly specific burning pins and needles sensation that many of us have unfortunately experienced firsthand, often jolting us awake from a dead sleep. To figure out why this happens, we can't just look at the fingers themselves. We have to look all the way upstream at the power source. Section 1. Meet the laborer's nerve. To get to the bottom of that annoying nighttime tingling, we first need to meet the anatomical star of today's journey, a thick, crucial band of tissue formerly known as the median nerve. Now, in anatomy textbooks, this is affectionately called the laborer's nerve. And that's because it supplies the flexor muscles in the front of your forearm, the exact muscles that give us our incredibly powerful grip. Every time you perform coarse hand movements for heavy tasks, like digging a trench, gripping a heavy wrench, or lifting weights at the gym, you're relying heavily on this laborer's nerve to fire off signals to flex those powerful forearm muscles. But what's really fascinating, and I absolutely love this, is that this exact same nerve has a second, completely different nickname. It's also called the eye of the hand or the peripheral eye. Why? Because it provides vital sensory innervation to the very tips, or the pulp, of your thumb and index finger. It literally lets our fingers see and feel fine details. When you assess the thinness and texture of a piece of cloth, or when you do something highly delicate like buttoning a winter coat, you're using the peripheral eye. It is a brilliant duality, right? Brute strength for the laborer and microscopic sensitivity for the eye. Section 2. Journey down the arm. If we trace a signal down this biological highway, it moves incredibly fast. In just 1 millisecond, it originates way up in the axilla, which is just the fancy anatomical term for your armpit. By 2 milliseconds, it crosses the midarm in front of the brachial artery, from the lateral to the medial side. At 3 milliseconds, it dips right into the cubital fossa, passing beneath a fibrous arch at the crease of your elbow. And by 4 milliseconds, it speeds straight down the forearm until it hits a notorious anatomical checkpoint at the wrist. Before we hit that checkpoint, let's just do a quick comparison of a robust median nerve with another major player in the arm, the ulnar nerve. If the median nerve is the laborer's nerve supplying the front of the forearm and those thin arm muscles at the base of the thumb, the ulnar nerve is basically the musician's nerve. While the median handles the heavy lifting, the ulnar nerve supplies the intrinsic muscles of the hand. Those are the ones responsible for the delicate, intricate motor skills you'd need to, say, play a sonata on the piano. Both are absolutely essential, but they have wildly different job descriptions. Section 3. The carpal tunnel. Okay, so the real drama in our journey arrives when our laborer's highway hits the wrist. This is where the median nerve has to navigate a very treacherous, tightly packed space known as the carpal tunnel. Imagine a tunnel made of rigid bone and thick fibrous tissue. And the packing list inside this thing is insane. You've got 4 flexor digitorum superficialis tendons, 4 flexor digitorum profundus tendons, and 1 flexor pollicis longus tendon. That is 9 long, thick flexor tendons all wrapped up in their lubricating sheets, and trapped right in the middle of all of them, sharing this incredibly tight space, is our solitary median nerve. That makes 10 massive structures forced through a tiny, unyielding gap in your wrist. There is literally zero room for error here. It's a textbook recipe for a major physiological traffic jam. Section 4. Carpal tunnel syndrome. Because there's no extra space in there, any slight crowding causes huge problems. When that tunnel gets even a fraction of a millimeter tighter, it leads to the globally recognized condition we know as carpal tunnel syndrome. And by the way, it's not just from typing too much on a keyboard. The tunnel can narrow due to tenosynovitis, which is the inflammation of those 9 flexor tendons. It can be caused by systemic issues too, like myxedema from a thyroxine deficiency, or even the natural fluid retention that happens during pregnancy. Even physical trauma, like a fracture dislocation of the lunate bone in your wrist, or degenerative changes like osteoarthritis, can shrink this space. But the end result is always exactly the same. The median nerve gets compressed and suffocated. When this compression happens, boom, it triggers the exact symptoms we asked about right at the beginning. You get that classic feeling of burning pain and nighttime tingling, specifically in the lateral 3.5 digits of your hand. You'll also probably feel some weakness in the thinner muscles at the base of your thumb. But here is the really crazy part. The skin sensation right over the base of your thumb, the thenar eminence, is completely spared. Why? Because the specific nerve branch supplying that patch of skin actually branches off before it enters the carpal tunnel and passes right over the top of it. It's an incredible little quirk of anatomy that helps doctors pinpoint exactly where the nerve is being pinched.
Section 5. Diagnosing the damage.
So, what happens if this intense pressure just isn't relieved? Well, things get pretty bad. Left untreated, the compression completely starves those thenar muscles at the base of the thumb of their vital nerve signals. Without those signals, the muscles literally waste away and atrophy. This leads to what clinicians refer to as the ape thumb deformity. Because the muscles that normally pull the thumb inward are completely paralyzed, the thumb just rotates outward, lying totally flat in the same plane as your other fingers. You end up losing that highly specialized opposition movement that makes the human hand so wonderfully unique in the first place. To stop this irreversible damage from happening, doctors have to play medical detective and diagnose the compression early. They use specific physical maneuvers, like tapping on the nerve to trigger a tingling response. That's known as Tinel's sign. Or they might have the patient hold their wrists in specific, sharply flexed positions, which is called Phelan's test. For absolute definitive proof, they can actually measure the electrical speed of the median nerve itself. If the conduction velocity drops below 30 meters per second, for sure, that is a definitive diagnostic sign of a major roadblock in the carpal tunnel. Honestly, when you step back and look at the anatomy of it all, it's just wild that a single millimeter of swelling, a tiny shift in fluid, or a slight thickening of a tendon can completely short-circuit the peripheral eye of your hand. It takes this incredibly powerful laborer's nerve and turns it into a source of agonizing pain, all because of a slight design flaw in an impossibly crowded wrist tunnel. Which leaves us with a kind of fascinating, but honestly, maybe a little unsettling thought. If our wrists are this precisely and precariously engineered, where the difference between flawless function and agonizing paralysis is measured in fractions of a millimeter, what other anatomical bottlenecks are hiding right under our skin, just waiting for the perfect storm of pressure? Thanks for joining me for this explainer, and keep questioning the incredible machinery that carries you through the world.